changed. We were originally called Hospice of Hilo, and now we're called Hawaii Care Choices, largely because we have expanded our program base. So we have palliative care, hospice care, and bereavement care. Hospice care will still be at the center of everything we do. However, now we have palliative care, which is a pre-hospice program. And for those who don't even know what the word palliative means, it means to palliate, to ease, to alleviate, to relieve, to soothe. So this is very specialized care that we provide people who are dealing with a serious illness. And oftentimes with those who have serious illness, they will have treatments, and from those treatments, they will have symptoms of pain, other types of discomforts, and palliative care directly and specifically address all of those areas of discomfort. And so really, palliative care is all about providing relief. And for the most part, the reason that palliative care is so important is because it's there to boost the quality of life. So who is appropriate for palliative care? In our program, anyone with a serious illness such as cancer, any type of cancer, any stage of cancer, and also CHF, congestive heart failure, COPD, and advanced kidney disease as well. So patients can be of any age. The youngest patient we had was 9 months old. And really, if anyone is dealing with any of these serious illnesses, they can come and receive services from us. So oftentimes when there is a serious illness, there are treatments related to that illness, and chemotherapy, radiation, dialysis, and sometimes surgery occur. So patients are often in pain and need relief. Patients do not need to have a terminal diagnosis or a 6-month life expectancy in order to receive palliative care. Oh, brain teaser.
Sorry, I apologize. I was muted. Oh, 2020. A poll is on your screen now. The goal of palliative care is to improve the quality of life for patients and their families. True or false? Again, for those of you watching on Facebook Live, you will not be able to engage in the live polls. If you would like to join in the fully engaged Zoom presentation next month, please email me, lfukushima@hawaiicarechoices.org. Mahalo. All right, looks like we got a whole bunch of polls in. I'm going to go ahead and end the polling here and share our results. So the goal of palliative care is to improve the quality of life for patients and their families. 100% of you said true. Mahalo for participating. Go ahead, Lani.
So I really love when people have had their coffee in the morning because they're totally paying attention. I always check them on the first brain teaser just to see, and you're absolutely right. Everybody got that one right. It is, palliative care is there to boost the quality of life, not only for the patient, but for the family as well. People will ask me, so when is palliative care needed? Well, some of the physical signs you can notice with your loved one, family, or friend, if they are dealing with a serious illness, is if they tend to start going to the hospital or calling or visiting their doctor often. And when I say often, I'm saying like a couple of times a month. You know, they may have some kind of incident or episode at home and they need to rush up to the hospital. That's definitely concerning. Also, difficulty in managing your medications. There's so many medications at some point that they start to get confused and they don't know which one they should be taking. Those are also signs of it. Some of the really obvious signs are, you notice that it's difficult for them to drive, or they start buying things that they don't even have any money, or they have difficulty just managing their checkbook. And then, something as simple as preparing a meal, it's too much, for them. They can't even do light housework, such as, throwing in a load of laundry or something. These are physical changes that start to happen that you can notice. And, many times we are raised to just minimize all of these types of symptoms that we have. So oftentimes we'll just make excuses and say, oh no, I feel kind of tired, that's why, and all of this other stuff. But watch, really closely watch, and you can see. Also, people will start to complain about fatigue, maybe even swelling in their legs, and feeling nauseated, and having pain, just discomfort. And normally it's because they're getting these symptoms from not only the illness itself, but from the treatments that they are receiving as well. So when should palliative care begin? A lot of times people don't call us until they're really deep in the weeds with a lot of discomfort. But really, call us at the time of diagnosis. You might not even feel it's necessary because maybe yourself or your loved ones are not actually experiencing any discomfort, but it's really good to learn about what will happen when the team comes to your house. That's what's so wonderful about this program, is because you don't have to go out to see your physician. We will come to your home and we will be part of the physician team. And so this is really important with regard to a organization such as Bay Clinic, because they have such wonderful providers all over different parts of the island. And it's really great to become an extension of the providers team. And so we tell people to definitely call us for palliative care at time of diagnosis, and we will stay with them throughout the course of their illness as they transition possibly towards the end of life, when hospice care can be more appropriate at that time. So those with serious medical issues could actually live longer by signing up early. And it's because we can keep people more comfortable and less stressful. And a lot of times the stress is what really brings in some of that dis-ease. So Tish, do we have any questions yet for Kimo?
Yes, we do. Kimo, when did you become the CEO of Bay Clinic, and what positive changes has happened since then that have directly affected the community?
Hello, everybody. So this is awesome. Thank you so much for inviting. Yeah. So, oh man, so much to share on that. It's been almost a little over a year since I started. So I could tell you a story by starting off with the history. So I don't know, Lani, you continue your presentation, and then I'll just jump into it. Yeah, I think when I share with everybody the history of Bay Clinic, because we've been around since 1983, and then you'll see the progression. Because I also give some props to, many who has walked before me, and I kind of give some props to them too. So.
Okay. So I'll continue. There's I think. When I come onto the hospice side, or would you like me to finish all the way through hospice and then you can come on and do a presentation? Well, you have, awesome. So let's just keep going. Let's just keep flying on this. Okay, next slide, please. All right, so what to expect when somebody signs up for palliative care? Well, first of all, you can just call our office direct, okay? And even if you didn't speak to your doctor, we will circle back and call your provider and get them in on the loop on what your concerns are. So basically, our nurse would come to the home. She or he would make an evaluation of your health and your medical history. And then, we would start with the family and kind of let them know what our overall program is going to be. So what's really important on that first visit is we want to know what is the patient's biggest concern. So oftentimes the kinds of things that we will hear is where a patient will say, you know what, I just want to be well enough so I can see my grandson graduate. Okay, so that's in 9 months, and then we just start working backwards. These are all the things that we will create in your plan of care so you can make that. And oftentimes it's so important for us to know the goal of the patient, because when a person is dealing with serious illness, there has to be some inner inspiration that really keeps them inspired to keep trying. And that's why it's really important for us to to not create goals for them, but to know what they would like to do. Sometimes people will say something as simple as, you know, I just want to be able to get off the couch and walk to the mailbox and come back without being totally breathless. I mean, if you can help me with that, that's golden for us. So, you know, there's big and small types of goals that patients share with us, but really it's very patient-centered. We're not just helping them with the disease that they have. We are really serving the patient overall as a whole.
Lani, we have a question from our audience.
Okay.
For you, does Hawaii Care Choices provide direct services for individuals receiving palliative care? For example, laundry, medicine, and financial management.
So we do have a social worker that is part of the team, and that person would come in and really assist in those areas on what a person qualifies for and what is available for free out in the community. So there's a lot of resources that we can connect people to that they had no idea with. And so, yes, all of those can be addressed when somebody is on palliative care with us. Okay, medication review is one of the big things that happens on palliative care. And the reason is sadly right now, a lot of how healthcare is distributed is siloed out. So let's give you an example. Like say, you go to your primary care physician and then you get medication from your physician, and you have congestive heart failure, so you go to your cardiologist and you get medication from there. Then there's some incident that happens at home in the evening and you rush up to the hospital and you get medication from there. And then there could be other ologists that you see as well, and you're getting medication. So this picture here with the balancing act of all of the medication is very real. We will go to people's homes and they'll have more than 50 jars of medication. And take note that some of this medication belongs to their dead ex-husband. Some will belong to their adult children that no longer live with them. Some will be expired, but they keep it anyway because they don't know if they'll be able to afford medication later, so they just keep it. And then they have all of their 37 jars of medication that they got from all of their current providers. So why it's so important with regard to palliative care is we will come in and help coordinate that medication and do the medication review for the patient.
Lani, we have a question from Facebook Live.
Okay.
Could someone with dementia participate in the palliative care program? Will their caregivers, family, or representative be involved?
Dementia is really one of those illnesses that if somebody has dementia alone, it's difficult to put them on palliative care. However, if they have any other underlying diagnosis, such as, you know, congestive heart failure with diabetes or other types of diagnosis, we're able to bring them in so that they can get the care that they need. Sometimes it's just a matter of going in for a checkup with your current provider to find out that in fact they do qualify for palliative care because there could be another underlying medical issue there that we maybe were unaware of. So we'd like to provide care for as many of those that are on dementia as possible. And so oftentimes it just takes another look by the provider to provide that service. How does palliative care work? So basically we come in, there's a team, there's a registered nurse, we have a provider that comes to the home as well, and we have a social worker. So those are the three main ones on the team. If somebody needs spiritual care, we also have a chaplain that can come to visit, and we also have trained volunteers that can come and help out so that the caregiver can get rest. For the most part, we'll come in and we will address the pain and any symptom management that the patient may need. And those symptoms are the ones that I had mentioned: pain, nausea, depression, those types of things. We'll come in and help really manage that. The care coordination comes in because we find that patients are having to see more than one doctor. And it's so difficult and maddening at times to just get organized on, okay, so you're going to take mom, she's going to go to, okay, then who's going to take mom on Saturday? She got to go over here. And but we have another meeting, or we have another appointment on Friday. It starts to get really hairy at times. And so we have somebody that will come in and help to do the care coordination, and that's normally our RN, our registered nurse, that comes in there. Our plan of care is created solely around the goals of the patient and the family. So like I said, when somebody says, oh, I want to go to my 50th year class reunion at Vegas, we start working those dates back so we can get people healthy enough to go. And the kinds of changes that we may suggest is, nutrition, exercise, those kinds of things that, that doesn't cost anything. That just is an intentioned plan that we put in front of someone. So obviously, if somebody can't breathe because when they go to the mailbox and they come back and they sit on the couch, they can't breathe. Well, maybe they cannot have Spam every day like they've had for the last 40 years. Maybe they got to cut back on the Vienna sausage, not so much rice. All of those things is part of the education and plan of care. And also, our social worker is able to come in and address other concerns, like the concerns that an earlier question that came up with regard to the type of care, with the type of services, and also maybe somebody needs Medicaid as well as having Medicare. And our social worker will be able to help them complete all of those forms, as well as having the very important document, Advanced Care Directive, so we can do that as well.
Lani, we have another question for you. How often does Hawaii Care Choices come to the home to check on a patient?
It really depends on the illness degree of the patient. But I'd say for palliative care, the visits would be more like once a month in the beginning. And then more so, more frequency would happen depending on how the illness progresses. So we try not to, full court press the family, because, local families, they don't really like other people to come to their homes. So once we come the first time, then, we become family and it's all good. But we try to, just check in more with people over the phone initially, especially if you're calling us at diagnosis. So, there aren't a lot of symptoms for us to really manage at that point. But as the sequence or progression of the illness continues, then that's when our visits to the home start to increase as well. And we don't all come together. That's another thing too, because that can overwhelm a patient too. Some patients actually like it because they feel quite isolated and they really want the company. But for the most part, the registered nurse will come by herself, and the social worker will come by herself, and then the provider, which people will ask, oh, what is the provider? The provider is the actual doctor that will come to the home and see the patient. So how is palliative care paid for? So it depends. It really depends on the kind of insurance that a person has. For the most part, a lot of people that come to us have Medicare, and so the visit for the doctor and the social worker would be charged as a visit, say, to any of the doctor's offices. There could be a copay that would be anywhere from $20 to $40. However, we have quite a few patients that have Medicare and Medicaid as well, and then there's no charge at all for all the services that are provided. So it really depends on the insurance somebody has. Oh, and before I move on past that, I wanted everybody to know that those who are veterans, the Veterans Administration have their own palliative care program. So sadly, many vets would call us to see if they can come on our palliative care program. However, we're happy to report that the VA has their own, and so they are able to contact their organization directly to receive those services as well, which are included. So on to hospice care. And this is so great that you folks are just asking questions, because I'm happy to stop at any point and just answer those questions, because there is quite a lot of information that I'm unpacking for you folks right now. And at any time that you have a question, please feel free to ask. So this is the difference on hospice care and palliative care. The difference is that we are not looking at the quantity of life at this point. We're looking at the quality of life. So sometimes when people are in palliative care, they're really looking at their treatments such as chemotherapy, radiation, and even dialysis. But once you come onto hospice care, it's all about the comfort, completely about the comfort. So there isn't any more treatments that anybody is trying to seek at that point. It's really about treating the person versus the disease at this point, and really keeping the patient comfortable as possible. It's really all about quality of life. So there would be sometimes that, say, a mother is taking chemotherapy, but her quality of life has really diminished, and she can't eat, she's very frail, she can't get out of bed, she can't spend time with her family that she wants to. However, there is times where patients decide no longer to have any of those treatments, and when that happens, sometimes it's just focusing on being together with loved ones and just being kept comfortable so you can enjoy the stories and the laughter of your grandchildren, or just take time to, you know, watch the kids swim down at the beach. All of those things without, you know, feeling so horribly uncomfortable during that time. So when people ask me, why was hospice care created? I explain to them that hospice care wasn't created because of death. Hospice care was created to ease terminal suffering. The end of life does bring suffering for some. And when that happens, hospice care is there to answer that call. So terminal suffering is very, very specific. And when people will think about hospice, sometimes they think, oh, hospice equals death. No, that's not right. Hospice is actually going to come in and provide the comfort. Also, there's a approach to really dealing with the overall person. So we would come and address the emotional and spiritual stress and discomfort that occurs as part of the end of life sequence or progression as well. So this is the team, the hospice team that would come in. So we would have a nurse, a physician, the doctor come in, the spiritual counselors. We have trained volunteers, our grief counselors. We have our social worker, and even our home health aide. And our home health aide, I tell you, some people, they could not imagine not having the home health aide. And that's because that person comes in and teaches how to give the bed bath, how to turn someone so they don't get bed sores, feeding somebody in bed if they're unable to get out of bed. These are things that people are not just born to know. We will actually come in with our team and teach the family how to lovingly care for their loved one while they are ill. And I tell you, honestly, myself, I know that the family member receiving such loving care often lives longer, largely because they're not dealing with so much dis-ease, so much stress. So hospice comes in and doesn't only care for the patient, but supports the entire family as well. So who qualifies for hospice care? First of all, anybody that is dealing with a terminal illness qualifies for hospice care. The doctor has to make his or her best guesstimate of a 6-month life expectancy, and the patient is no longer seeking any curative treatment such as dialysis, chemotherapy, etc. Oh, here we go.
Here's another brain teaser. So the question is, hospice is where you go in your last days, true or false? Just a reminder for those of you watching on Facebook Live, you'll not be able to engage in the polls, but if you'd like to join the Fully Engaged Zoom next month, please email me at lfukushima@hawaiicarechoices.org. And again, I just want to say thank you for everyone who is utilizing the Q&A box, utilizing the chat to send in those questions. We really appreciate it. Okay, we have a few more. All right, I'm going to go ahead and end the polling and share our results. The question is, hospice is where you go in your last days. 44% of you said true and 56% of you said false. Thank you so much for participating in our polls. Back to you, Lani.
Thank you so much, Tish. So let me explain a little bit about the understanding of when it's time to call hospice. The earlier you call hospice, the more support we can provide, not only for the patient to keep them comfortable, but for the family as well. So let me give you an example. So when people think that hospice equals death, and possibly by calling hospice, you might hasten the death of your loved one, people don't call. So somebody will say, oh, you know, are you going to call hospice because mom looks like, you know, she's getting worse? And then the response is, no, not yet. Looks like mom is going to hang on at least another 2 weeks. We'll call them later. In other words, we'll call them in the last 2 days before mom passes. And at that point, this is what you need to understand, is we could probably get mom's pain and discomfort under control. What is so sad is that mom had to suffer for months, if not longer, because we couldn't come in. Nobody called us to come in to help her ease all of that discomfort. The other thing is the family. The family is not prepared now for the passing of mom. Yeah, they know that mom's been sick and her disease has progressed, but no one has come in to counsel them, to support them, to teach them ways to deal with this anticipatory grief that is just creeping up on the family. So let me give you an example. So say when I liken hospice care to service, I think to myself, let's just say all of us are scheduled to take a flight to heaven. And we're all on Heaven Airlines. The destination is clear and it's charted. Some of us will go at noon, some will go at 2 o'clock, and some will go at 8 o'clock at night. Make no mistake, we're all gonna go. For all of those who signed up for hospice care, them and their families will go directly to the first class cabin. And that's because that's where all of the comfort resides. And for all the rest, for whatever reason, they didn't know that there was hospice care, they were afraid of hospice care, they were reluctant to sign up, etc. They don't go to the coach part of that airplane. They go to the baggage compartment of the airplane. And the reason they do is because that is the coldest, hardest, roughest ride all the way to the end. And they go not only with the patient, the entire family goes. And although they head over and their loved one passes over the bridge to heaven, the rest of the family takes that horrifying ride back. And many, upon landing, just break into so many pieces. It's so difficult to recover from grief like that. And so I tell you now, the earlier you call hospice, the more support that you and your family will get, instead of delaying and thinking that hospice will hasten the death of your loved one. It's quite the opposite. So remember, call hospice as early as you can. And when people say, so when is it time to call hospice care? Physically, you can see the changes in your loved one. So, you know, somebody is going to the ER a lot. They tend to be losing weight. Maybe they're falling a lot, and they'll also be making a lot of excuses during that time. So know that that's just a smoke screen. Also, they tend to have difficulty getting out of bed, or maybe they want to sleep most of the time. They don't want to eat very much. They don't want to drink very much. And also, you'll start to see the skin really thinning, and different types of infections start to show up as well. So how does hospice care work? First of all, we come to the home, just like we do for palliative care. And in that program, there's a lot of things that are included. Medications associated with the diagnosis that the person came into hospice, that will all be included, along with all the medical equipment such as hospital bed, oxygen, wheelchair, any of those types of medical equipment that they may need. That's all going to be included as part of the hospice program. And again, a person can keep their primary care physician if they wish, and that person will become part of the hospice care team. So what to expect when you sign up for hospice care? Basically, we're going to create a care plan based on what are the wishes of the patient. And of course, we will make sure that the family is involved in that too. And our entire team will be following that care plan.
All right, everyone, it is time for another brain teaser. The question is, my culture expects me to take care of my family with healthcare needs at home. The choices are strongly agree, neutral, disagree, or strongly disagree. Again, just a reminder, we appreciate all of you on Facebook Live who are watching. Unfortunately, you will not be able to engage in the polls, but if you want to join our fully engaged Zoom presentation next month, please email me at lfukushima@hawaiicarechoices.org. Right, thank you everyone for putting in your answers. Just give it a few more minutes. Okay, sounds good. I'm going to go ahead and end the polling right there and share the results. My culture expects me to take care of my family with healthcare needs at home. 25% strongly agree, 38% agree, 29% are neutral, and 8% disagree. Again, thank you all for joining in on our polls.
So this part was very important. That question is, oftentimes we were raised to understand that it was our responsibility, our kuleana, to take care of our loved ones. We are not to be calling somebody else to help us. In fact, it was quite shame for many family members if they actually decided to do that. And so many, when they call us, are in such distress. They're actually disappointed in themselves that they couldn't do it themselves. But this is what I tell you, is if that is your father, if that is your husband, if that is your uncle, if that is your brother, know that you cannot be a good wife, a good brother, a good child, a good niece or nephew if you're being the caregiver 24 hours a day. So when you call and you get help, you tend to be able to not only be their caregiver, but to be a better wife, to be a better brother, to be a better child. So understand that there is no shame in calling for help. Know that we will help you in a way that you will become even closer in bond to your loved one. So go ahead and call us early. So who qualifies for inpatient care? Some of you may not even know that this place exists, but it's on Kapi'olani Street, right in the center of Hilo Town. And it is a very, very specialized place. In fact, some people ask me, when they come to visit, it's like the Mauna Lani of hospice. It's really, truly a beautiful place. I consider it like an intensive care department for the community. I mean, it has the high level care at this facility. It is not a long-term care facility. People do not come here and stay for 3 years. For the average stay is about 14 days. And the majority of people that come here will actually pass here. For others, we're able to help manage their symptoms here, and then we send them back to their loved ones so they can go home. For the most part, that is our number one goal, and we try to do that. But it appears that most people that come here are actively dying, and when they come here, they are treated like royalty. So this is a beautiful place to come. Room and board is not covered under Medicare, but it is covered under Medicaid or other insurances. So it's very important to know that. Should a loved one need to come here. And then, of course, private pay for room and board is acceptable as well. And how is hospice care paid for? This is the wonderful thing. This is the part that my mom had no idea. When my dad passed away with congestive heart failure, he said his only wish to us was to pass it home. And sadly, one evening he couldn't breathe. We called 911. They took him to the hospital. By the time we got to the hospital, he had already passed. So that was an epic fail on our part. And it was such a small request, we thought, that we could clearly do that. Years later, when my mom was diagnosed with lung cancer, her doctor said to us, "Oh, your mom can have hospice care at home now." So we said, "Oh, okay, what is this hospice?" And anyway, the doctor explained to us, and we thought, okay. So my mom, being a staunch, pure Hawaiian woman, she was not going to have it. We knew that, but we figured, we just go in and make the act. Me being the youngest in the family, I decided that I'd go in and take on the challenge. So I go in and I say, Mom, guess what? You can get hospice care at home now." She goes, "Hospice? Oh my God, I don't need hospice. I'm going to live a long time. In fact, I don't even like that word hospice. So I don't bring that up to me. I don't need that." Okay, so this was my conversation I was having with my mom. This is how it was going. Obviously, to an outsider, it wasn't going too good. So how I did that is I said to her, "Oh, okay, so Mom, you're not about then having hospice care." She goes, "No." I said, "Oh, okay. Well, I heard we can get free stuff." "Oh, yeah. Like what?" And I said, "Well, because brother is, renting the wheelchair, and, there'll probably be other things that you may need." And, she goes, "Oh, so they can give that to us for free." I said, "Well, it's included because you have Medicare. It's 100% covered." She goes, "Oh, no, that is a gimmick. You cannot believe that. They're going to send us the invoice later." I said, "No, okay, Mom. So if I check and they say that it is included, then what?" She goes, we should sign up. We're going to save money if we sign up." I said, "Okay, so then that's what we'll do." Okay, so right there, what I did is I just changed it from a medical focus to a financial focus, and so my mom went for it. Okay, so if you have family members like my mom, I want you to know that that scenario works every time, no problem. So what ended up happening is when we signed up, the hospital bed, all of the things that she wasn't even using it, oxygen, all of that, they all came. And it was amazing, the work that the team came and all of it was included. That as months went on, she said to me, "Oh, I'm so sad Daddy didn't even have any of this." And I said, "Yeah." She says, "And it was all included because we had Medicare and probably the other insurances too." I said, "Yeah." She says, "No, I know these Hawaiians outside. They're not going to know about this. You go out there and tell them right now." I said, "Well, it's a little awkward, really, Mom, for me to go tell the neighbors, about signing up for hospice right now. It's probably not relevant." She goes, okay, I get it. You don't have to go and tell them now, but I want you to figure out how you can tell all these people about this wonderful benefit that's included, and the government doesn't give us anything. This is the final thing they're going to give us. We should make sure we get it." I said, "Yeah, I know. Well, I'll figure it out." So here I am, over 10 years ago, going out to the community, explaining to them about these wonderful benefits that are included with Medicare that hospice provides. This is not the job that Hawaii Care Choices has given. This is the promise I made to my mother. So I continue to do this every day because I believe in the mission. And in fact, she doesn't want anybody to leave from this earth without knowing of these wonderful, wonderful benefits that are included. So I say to you, you have Medicare or any of these other insurances, it's included. All of it is included for hospice at home. Okay, so believe me, sign up for it. Also, our wonderful trained volunteers, there'll be people that are their caregivers. Okay, so husband is the patient, the wife is taking care. Okay, then we'll call the wife and she has signed up for hospice. I mean, amongst all kinds of hesitation, she finally signs up. Then we call her and say, you know what, we're going to send a trained volunteer to your home so that you can go, you know, you can go and take a rest if you want. You can go clean the yard. You can go Walmart. You can do whatever you want. We'll send a volunteer to sit with your loved one so that you can have rest. The initial response is always, no, I don't need that. No, I got to take care of my husband myself. Okay. We will keep pushing the issue until they finally agree. And when they do, then they realize, wow, I'm such a better wife and caregiver because I get the rest. And it's because these miracle workers, our volunteers, are just amazing. And so, remember I was telling you about that airplane ride, right? The family comes back. It's a horrific ride back. When somebody signs up for hospice care, they get 13 months of bereavement care following the passing of their loved ones. And I tell you, that is the glue that brings people back together. So know that hospice is there for your loved one, but boy, the amount of support the family is going to get is unbelievable. So definitely, we have bereavement care, not only for those that were on our hospice programs, but even those that are in the community, maybe, you know, from a car accident or some other accident, somebody loses a loved one, they can come to our community bereavement, which we are doing all over Zoom now. So we keep everybody safe. And we also have children's bereavement as well. And we're doing virtual children's camps, team camps. It's really quite amazing. And we're still able to reach out to our people and keep them all safe. Okay, so now let's head on over to Dr. Kimo over here and let him share with us all the things that is happening over at the Bay Clinic.
I'll do a share screen if I can, and then just so you guys know, I know I got Lieutenant Governor on, so just give me about 10 minutes, 10-15 minutes, and we'll turn it over to Lieutenant Governor. But I you know, the first question about Kimo, what have you done? And you know, since I first started, I feel a little bit shameful to talk about myself without talking about everybody else, because I really believe it's we and not I. So let me just share with you some thoughts as I reflect upon Bay Clinic, our history. We're super mission driven, always was. You know, I remember Bay Clinic back in 1983, and most people remember Bay Clinic as kind of like Planned Parenthood. You know, we basically birth control. But we've gone so far from that, and you know, and these are the pioneers. I mean, we started off at Kukuau Plaza. Annie Lindsay was the first director. Rochelle Matthews, she just retired. I spoke to her yesterday. To me, it's important that I acknowledge the people that Bay Clinic basically rest our shoulders on. So this is important, and we moved. I mean, we moved different places. We went to Hilo Lagoon. We added services as we moved. We expanded to Pahoa in 1991. We added a women's clinic as well. So Pahoa, we get family health clinic, we get women's clinic. We started the family health center in Ka'u. By the way, Lieutenant Josh Green was one of our proud doctors. Thank you very much, Lieutenant Governor. So we have a, I mean, and we talk about providers, right? Bay Clinic is one of the training grounds for most providers on the island had just like some experience with Bay Clinic. So also proud about that. And then we expanded, we built in 2013, pretty much a brand new building out in Na'alehu. So we provide services from Lapuehoi all the way to Ocean View. and then Hamakua Health Center from Lapuahoi to, you know, Kohala, and then West Hawaii Community Health Center, pretty much the rest of West Hawaii. So we are an FQHC, and let me just share with you when we got that designation. We got them in 2002. But before that, that designation didn't start Bay Clinic. You know, we started as basically grassroots, family planning, and then working our way and adding and expanding. So in 2001, we added dental. That was one of the questions. Do we provide dental? Yes, we do provide dental in Ke'au and in Hilo, and in Ka'u, we provide dental. In 2002, we received the FQHC status. In 2008, we moved from the Keaukaha site to our current family center site, which used to be the old Social Security building, right by the Office of Aging. Our administration moved as well there. In 2010, we added OBGYN services, women's health. We had a dental van. We added Hilo Dental. We got person-centered medical home status. In 2014, we added a pharmacy. In 2015, we brought pharmacy in-house. In 2019, 2016, with our mobile unit, so we can go out to places, rural places like Ocean View. We go to schools. We provide dental in schools when the schools is open. Right now, we're going to the homeless shelters. So we try to provide services where services are not being provided, and that mobile health unit is an awesome thing. So our administration moved right next to Midas here on Kilauea Street. So Bay Clinic has expanded, and why we've expanded is because we welcome everybody, all races, all genders, all countries of origins, all sexual orientations, all belief systems, you know, and basically everybody, regardless of their ability to pay, and that makes me feel good as a person born and raised Big Island. So we're a little bit different from the rural health clinics and the independent physicians even. Basically, we are unique. We are required to provide everything that you see here. We get on sliding fee scale. That means we're required to provide that. Rural health clinics not required to provide that, right? We gotta do a financial audit. We gotta get on board. We gotta provide pharmacy. If not, we gotta contract. We gotta provide preventive health. We gotta provide behavioral health. We gotta provide case management. We gotta provide dental. Bay Clinic is the biggest kept secret on the Big Island. Why? Because we are inherently a medical home, and so now we're providing street medicine, basically going to the streets. We get missions going out on Wednesday nights, but we also get community health workers who go out throughout the day, because those homeless patients, they're our patients, I believe, right? That's what our mission was created for. So like I said, it's hard to answer your question in the beginning, or what have you done? It's hard to say what have I done, because I've only orchestrated movement at Bay Clinic since I started. But the FQHC, we get on grant, we get on PPS rate, which allows us to get a little bit more money for Medicaid patients. That's why Medicaid patients, we embrace them. We think we're created to serve the poor and the near poor, but we're also like be the provider of choice. We also have a segment of the population that get commercial insurance. So we accept all insurances. This 340B is basically a pharmacy discount. So our patients get discounted pharmacy. We get on reimbursements for our pharmacy, which helps us offset some of the costs, because we also serve people without insurance, and financially we can take a hit on that. But our 340B and our PPS rate helps us to offset that cost. We get malpractice insurance from the federal government. So our employees actually federal employees. Okay, we get attorneys from the feds is our attorneys when it comes to malpractice, and then we get on loan repayment programs. So we're very attractive to providers, and we save money at the end of the day. Research has shown that when a client is served by a health center as compared to other health settings, we save over $1,000 a year per patient when you add up all the costs. And why is that? I tell you why, because uninsured adults are more likely to receive, which is what we provide, counseling on lifestyle issues, diet, exercise, smoking cessation, substance abuse, counseling on STDs, than uninsured adults seeking services someplace else. For example, women are significantly more likely to receive mammograms, clinical breast exams, up-to-date pap smears at community health centers at a rate that far exceeds the national rate for comparable women. So these additional, how we save money and how we provide awesome care is because by the nature of an FQHC, we get behavioral health, in-house. We get tobacco cessation in-house. We get health education in-house. And so it's just a matter of making a warm handoff. And when you get these extra services, it does reduce unnecessary hospital visits. It does reduce patients from going to, basically going to chronic having chronic health issues. So I'm just happy to be a Bay Clinic, because I think this is, like I said, the biggest kept secret on the Big Island. I got to tell you though, we made some huge changes. Since I started. Since I started was basically in COVID. Before COVID, well, even before COVID, you just come to our clinics. Once COVID started, we started implementing this screening, right? But we've advanced from that. Now we get this apparatus that basically, you just put your face in front and it checks your temperature, make sure you get masked, and then you get like when you pass, you get one badge that look like that says pass. Because we make sure that our clinics are safe, and the perceptions of safety just as important as the actual safety. So I like everybody know that we're doing everything we can to make sure our clinics are safe. So we get signage, we encourage social distancing, we remind patients if you get COVID symptoms, that we get out of the way for serve you. We sanitize high touch areas, again, mask mandate, and we installed these lights. So this UVC lighting kills 99.9% of the coronavirus in the air. So we get this at every clinic, because it's the airborne pathogens that we gotta watch, right? This is before our clinics. This is after. We've, again, perceptions of safety. It's just as important as safety, for our patients. So we've hired a bunch of providers in the past year. Just all kinds of enhancements, if you will. We've erected street medicine. So our street medicine program is not just going out in the streets, it's going to the homeless shelters, but we don't just send the medical, we send the behavioral health person there, we send the pharmacist there, so that they can get all their services at once. And we just got this shuttle, so we're going to be providing transportation now. We've implemented this UV lighting in the shuttle as another precaution. So these are all the changes that we've had to adjust because of COVID. And in the future is basically, we do community health assessments. We know that when we ask the question to the community, hey, what concerns you? Well, we know that 26% of our patients, substance abuse concerns them, mental health concerns them, elderly needs concern them, homelessness. So we are focusing on that top 4. I've enhanced a behavioral health program here at Bay Clinic. We're looking at providing eye health or eye care, which will attract a lot of our seniors to Bay Clinic. And we, of course, addressing the homeless situation. But we're not doing them alone. So my last slide is this. I went to the legislature and I asked Kaika Haley, Chris Todd, all the Big Island legislators, and I said, hey, help us draft one resolution so that we can work together, so that we can work with White Care Choices, so they can work with the hospitals and the rural health clinics, because there's a lot, right? So we can work with the independent physicians. So we don't gotta feel like we're competing with each other, right? Because competition gonna hurt us, right? If we're competing for patients, I think that at the end of the day, that can hurt us. But if we can collaborate with each other, like, hey, maybe I can help you with your high cost, high need patients. Maybe you can help me here. This is our niche. That's your niche. So I put this together and it was drafted, but then COVID came and really never take flight. But what I feel is that we get everybody, kind of in the position where, especially East Hawaii, I think we can come together and we can develop a comprehensive plan for Big Island. And I'm looking forward to that. So anyway, that's Bay Clinic. I'm glad to be here. You mentioned, Hawaii Care. My mom was a patient of Hawaii Care Choices. Wonderful program, Lani. You guys do a great job there. I get some friends on participants. I see my friends from the Office of Aging. I also coach at Hilo High School, so I see some parents of players that I coach, and it's good to be here. You mentioned a couple of words got me hungry. You mentioned spam and Vienna sausages. I started thinking about lunch, but hey, it's good to be here. So if you guys get any questions, great. If not, I see Lieutenant Governor, one of our previous docs at the Ka'u Clinic, is also on. So kind of excited to hear what he has to say. Thank you.
Aloha. Thank you so much. Thank you.
Thank you so much again. And without further ado, Lieutenant Governor Josh Green. Aloha. Thank you for joining us this morning.
Aloha. Thank you for having me. And thank you, Dr. Alameda. It's just, Kimo, it's awesome to hear all of what Bay Clinic has done. It brings back a ton of memories. In 2000, I'll just really briefly touch on what happened. In 2000, I was lucky enough to call and interview with the director then. That was Rick Custodio, and we hit it off. And they said, come and work in Hilo. We have a wonderful community health center that we're just starting to build in the community. And when I arrived, I was 30 years old, not married yet, hadn't met Jamie. I arrived and the team said, you know, we were going to have you work in this awesome town of Hilo, the city, but turns out we need you down in Ka'u. You're going to be just fine there. You're going to fit right in. And I did 2 weeks in Pahoa. Someone had a brief vacation that was on the books. And then I went down to Ka'u and was our doc. And it was just for 4 years, it was just the most wonderful experience ever. It's the only way a Haole from Pittsburgh should come to Hawaii and experience the people and begin to understand Hawaii if I could give a choice to people or a recommendation. It was just amazing. And the patients I was honored to see and become a part of their families was incredible. So reflecting on this and hearing you today and seeing the amazing things that you've done at Bay Clinic and what our Hawaii Care Choices team are able to bring us together to talk about is phenomenal. So it really is my honor as your Lieutenant Governor to come back. I wouldn't be Lieutenant Governor without you because you guys encouraged me to serve after I finished my National Health Corps commitment, which was with Bay Clinic. Like you mentioned, Kimo, I prepaid my loans and it was incredible. And now I get to serve in a healthcare capacity as LG. And so I'm going to touch quickly on where we are in Hawaii and then answer every question you have. I'm going to talk fast like my old days because I just want to share as much as I can and be able to riff with you. So would it be okay if I share my screen? Okay, let's do this. So this was yesterday for the Senate and for you, honestly. And so here we are in Hawaii for COVID. We are the lowest in the nation for cases per 100,000, lowest and lower than other rural states like Maine and Vermont. And we're 50% lower even than Maine. So the things that you've done in the community to be safe have worked. Like I said, 50% lower than the next closest state, but we cannot let our guard down because we saw how quickly things could get out of control in the summertime, even without travelers from anywhere, when COVID really spiked in July and August. That was from large gatherings mostly. And to some degree, we had extra gatherings in our Pacific Islander community, the non-Hawaiian Pacific Islander community in Kalihi and other places here locally on Oahu, big outbreaks, which is very challenging. Small percentage of our people, but a large percentage of COVID. 4% of our people contribute 30% of COVID during that part of the crisis. So if we do a good job with public health, we can beat that. And there we are for the whole pandemic, third lowest cases per 100,000. It's testament to the extraordinary sacrifice people in Hawaii have made. And by the end of this brief slideshow, I'm going to show you that we are now going to emerge even stronger than we were before. So I want people to have hope. Here we are. We've lost some of our loved ones. 262 people have passed. We have recently the lowest mortality rate, again, because great healthcare workers are out there doing what we need to do. And I'm just so grateful to hear that the street medicine program is a part of the healthcare universe that you've created. I love that. We're doing that here. I still consider myself a Big Islander in many ways. I still come back 2 weekends a month to cover the ER. I don't get to go to Ka'u as much as I used to. I miss it. I got to tell you, I miss it. And I'll be back for sure. And here we are for the whole pandemic. So again, Hawaii has done so much better than many people who we pray for because they've suffered greatly. I was just on a call with Alaska and a national group to talk about similar things. And they fall smack dab in the middle of this and they're going through a dark winter. We, of course, have the sun. And that's an advantage for us to be outside and a little safer. Then we had to deal with the reality because in March when we closed the state, we went from 800,000 some travelers, I'll show you that in a second, down to none. And economically, we know that how that affects us because so many of our loved ones work in tourism or their businesses are affected by that. And it's not about business, but it's about being able to pay for our health care and being able to have money for rent and not be food insecure and so on. The very challenges that all of the things you guys have mentioned, and being ready to have good hospice workers here, and being able to maintain our nonprofits. All these things are contingent on us making good plans to survive. So they asked me to get us going, and so I created the Safe Travels program with a couple others here in the health department and the HIEMA team, that's emergency management folks. And knock wood, it has worked. We started October 15th. We've now screened over 500,000 arrivals. 89% ended up getting exempted. 13,000 are currently in quarantine. Some others, of course, have finished quarantine after 14 days. Now it's going to be 10, just so you know. And that's about 2-to-1 visitors to residents. But 161,017 of the people we screened were ourselves, as we came back to be workers again and be back with our loved ones. And just, we had to travel because, we sometimes got to get off the rock, right? So that happens. So 361,000 were the visitors, and we had to make sure it was safe. And what we found is it has been safe because we put in a pretest, the 72-hour pretest, not perfect, but that, I tell you, chops down the numbers really significantly. And that means that we don't have to worry, and we don't have to just look sideways at the travelers that are coming in and wonder, did they come from a place where they're sick and they're going to make us sick? We couldn't afford that psychologically or spiritually or from a tourism standpoint. So that's why I put that plan into place. And you can see just statewide, 299 total positive travel cases, and that's over the course of 7 weeks. So it's very small number, right? Over 50 days. So it's just a few a day, but it meant that we got some hope back. And I'll get to that in a moment. You can see there, for instance, Hawaii County, just 73 positive travel related cases out of 82,000. So if you pop up your calculator, you can really see fast. So 82,000 divided by 73, that was just 1 out of every 1,100 people. And that's good, because if we don't have any travel, we know what the consequences are. It can be very tough. And here's how it looked before and after. I like to be analytical because I want us to make decisions based on that and be smart like we are in healthcare and when people need it. So then we can be compassionate with good decisions. So before we started getting back going, we had 105 people in the hospital statewide. After, we have 47 as of yesterday. Before, we had 92 cases a day. I should have waited to put the slide up today because our average case count's now 90. It's lower, but same, okay. Statewide positive rate was 2.8%. Now that we have more people coming, a lot more, you can see with the same numbers, it's lower percent. And you can see what our positivity rate before and after was for the islands, right? It was 2.8% for Hawaii County, and now it dropped to 1.19%, which is an incredibly good thing because of how smart you've been, honestly, and how hard people have worked to make sure we have masks. 88% of people now wearing masks on a routine basis, way up from where it was before. And that's how you stop COVID, and you do the right things in our health centers and our hospitals. And there's a good look at what it looks like for the number of cases with the chart and our current hospitalizations. We're down at 47. That's down 55% from before we started Safe Travels. It actually got up to 318 at one point. So 47 divided by our maximum of 318, we're under 15% of our peak. And I'm not saying it will stay there. We'll have to be really good, but it made it possible for us to get through to the vaccine. That's been my responsibility, to get us as safely as I can to a time when we can get vaccinated for those who choose it. Because I know and I respect if people choose not to be vaccinated, that's okay. I lived in Kau for a bunch of years, right? So I know people are strong-willed and make good decisions for themselves. So nothing will be forced on people, but if many people get vaccinated, it will make our lives probably easier for the next phase of COVID. I'm going to get a vaccination. I even had COVID, and I'm going to get vaccinated for what it's worth, okay? I had COVID in September. So this is what it looked like for Hawaii, just to give big picture. January was normal. No one knew COVID was coming. February it was starting, but no one really knew. And then in March, we knew, and we shut down. So you could see we went down to 400,000 people coming because it was half of March. And then when we were full shutdown, we were down at 4,500 total people. Total. Remember, we have a 1.4 million people live here, and we only had 4,000 people travel back in. But then as you go through the summer, it was quiet, almost silent, way under a couple percent. October, we started opening, and then November, 247,000 travelers, a third of which were our own family and friends and kids that come back from college and whatnot. But it reunites people. It gives us hope, and it means that we have an economy. And it has not meant any extra cases. I mean, really, our case counts have dropped because people have done so well. You could see how tough it was. Very tough on Big Island, tough on for all of us. The Greens neighbors, Oahu, but that's how many unemployment considerations we had to make. Like over 150,000 total people went unemployed in our state, and that's changing real fast. We're recovering even just in 6 weeks. We're starting to recover, and we'll still be safe. We've got to be safe. If it gets worse on the mainland, it gets worse for us. But having the vaccination, having a safe travels program that's pretty sensible. The mayor of Big Island, special thanks and kudos to Harry, who deserves our incredible respect, though he's got to be the most stubborn guy in the planet. He did a great job seeing us through many of the challenges. And now I'm so excited and proud of our new mayor, who's already diving in a smart way. So I feel positive about both past and present leadership, and Billy in the day. Such a smart, passionate leader, also helped us for all these years with Bay Clinic. But you can see our past year counts are going up and our COVID cases are coming down, which has been good. But this is really what it's all about for me. And this is the last slide I've got, I believe. Look, we know in our county of Big Island and for our catchment and service area of Bay Clinic, we know we take care of those who struggle, who are on Medicaid, who have MedQuest. We are now at 380,000 people statewide, which is 1 out of every 4. We're closer to 1 out of every 2 in some parts of our Big Island who need some support. Healthcare is expensive, it's tough, but all of those things that Kimo talked about very, very intelligently, of course, were the PPS rates and wraparound services and referrals to end-of-life services and getting a living will done and all these things. That makes the difference for our people, especially my aunties live on Healy Street, in Hilo. So, I mean, this is very real for us, just up the street from Bay Clinic and Hawaii Care Choices, of course. And so I know how this plays out for us and how badly we need it. But through the COVID crisis, we've had 50,000 new individuals have to go on Medicaid for a time, 15% increase. That's a big deal. A lot of those individuals, our family and friends, will come off of it because they'll get back to their jobs. But some won't, and we'll be there to help them. The impacts of COVID, though, are extraordinary. The mental health care impacts, maybe more than any. 43% of our people have felt lonely. These are the things we always ask about if we're wondering about depression. 42% pessimistic, that's whether they have hope. 34% feeling overwhelmed, that's feeling sense of desperation. And all of those contribute to self-harm and so many different things that we often work on together as healthcare providers. So it's critical to recognize that. And that's one of the things that drives me when I push our guys to make sure we make good decisions on healthcare safety and good decisions and strike a balance on economic support and survival, because otherwise it translates into other stuff like self-harm. One of our medical practices that we have worked with a lot, all of us as partners, I won't name them just because I don't want them to feel, singled out, although it's for a good reason. They've upped their game also, like you guys have, on mental health care. They've seen a 3,000% increase in plans to harm oneself and calls about that for their practice. It's so high that you almost have to consider it a new phenomenon. And so we have to have a call to action and to be supportive and to get through the COVID crisis, to get back to whatever new normal is going to be. But there you see another number, domestic violence, 46% increase in calls. We've even had tragedies in my building. There was a tragedy that was reported about a terrible event that was both domestic violence and just plain violence. So it happens close to home. I mean, I can't even tell you how close to home. I hesitate to even mention it today, but it's unbelievable. And then there's even food insecurity, increased by 60%. 1 out of 5 of our people is food insecure, and usually it's kids. Because they can't get their meals at schools now, right? So we have to get out of COVID, and we have to get out soon, if possible. And then finally, housing. 11,000 plus households were behind on rent. And if we didn't freeze evictions, you would have seen homelessness quadruple. And it's already really bad, right? Because we know the challenges there. In fact, our team is eager to get back to solutions on homelessness once COVID's done, because that's kind of our mission. So all of these things are very real. And I wanted to kind of pause there and just say, thank you for welcoming me and letting me share what we're all doing together, because I could not even begin to do it if I didn't have the partners that we have in you on Big Island, on Maui, on Kauai, Molokai, everywhere, right? It takes this true teamwork to survive these troubled times. And then we go back to what we do. And then we can remember how different Big Island may be from Oahu or Maui. But for now, we kind of all are got to be on one team. So it's great to be with you and see what you're doing.
Well, thank you, Lieutenant Governor. We appreciate all of that information. I know there's a lot of questions coming in, and you did mention the vaccination. If you can just kind of let us know a little bit more on what's going on with that. How is it coming into the state of Hawaii? Is the state controlling who gets the vaccinations? What kind of information, and also what kind of information is out there for those who are undecided about getting vaccinated?
So much to share. So, okay, first of all, vaccinations will begin next week. The vaccination looks like this. I think people like to have a visual. Each box or container, first it's going to be the Pfizer vaccine, is a 9-inch by 9-inch by 2-inch container, which holds 975 doses of vaccine. Then there's a bunch of dry ice. So people have this idea, my God, it must be a room full. No, it's small. And that would be 975 people. The first batches go to what we're calling phase 1A, which is healthcare workers, especially healthcare workers, and our kupuna who live in long-term care facilities. That's the very most vulnerable groups, okay? And the way we're doing it, and I've been in constant meetings this morning and then now and then this evening too, and we'll make sure we get you the link today for tonight's healthcare meeting, which is an open town hall meeting from 6 to 8:30 Zoom, so that people can get all of these details. I'll be presenting part of it, but lots of extra information. What it's going to look like is the hospitals are going to be the first hubs for people to get vaccinated. So any of your healthcare organizations, like for instance on Big Island, connect to Hilo Hospital right now. So they can ask for more and you can go get them there without having to do a big lift in this first phase 1A, okay? Individuals who are at long-term care facilities are going to be supported by CVS and Walgreens, and they're going to get their vaccines that way. So we're going to take that first large group, and it's any healthcare worker, allied healthcare worker, we want them to go to these vaccination hubs or centers. And as we go forward, we'll come down off of the highest risk groups, which is healthcare providers, because we can't afford to catch it and then spread COVID. We take care of that group and our first responders, who also fall into these early categories, and then move on to less at-risk groups, but who are still critically in need of vaccine, like anyone with some chronic illness, like someone has diabetes, someone's got a high blood pressure, someone survived chemotherapy. Then we move to the much lower risk groups, ultimately healthy young people, like yourself, who, unless you're in healthcare, of course, right, you have to get it. But if you just don't have a high risk, then you wait a little longer, and keiki, they come later, hoping to get everyone vaccinated by summertime. And our goal right now is to get 84,000 doses of the vaccine into people in the first month. So it's a lot of people, actually. The first batch comes in very likely next Tuesday or Wednesday. And that batch is, I will tell you, spread out equally across population, try to be fair to everybody. It's 12,675 doses, followed by another similar amount, and then it ramps up real quick. So people should be patient for this first month, but I hope and expect that almost all healthcare workers or people who choose to get it will get vaccinated in the first month. Now, people who have very serious allergic reaction profiles with anaphylaxis, severe allergies to medications, right now we're advising to pause before getting the vaccination, but everyone, in my opinion, should get it if they believe in vaccinations. I'm not going to force anyone to do it, just so that everyone understands that. But if we can get to 60 or 70% vaccination rate in our state, we'll get herd immunity and it will benefit all. And meanwhile, for every vaccination we get, it's one less person I worry about ending up getting very sick. I had a 51-year-old friend from college die. He was a marathoner, better shape than me for sure. And you just can't figure how it's going to affect people. It's usually our kupuna. Certainly the mortality rates go way up when people are over 80. So that's our general approach. And what I'll try to do is I'll try to have you just fire questions at me, and I'll give you, rapid answers if I can.
Thank you. I appreciate it. Again, another on the vaccination. Are there any known side effects as of yet?
Yes, the side effects. In fact, by the way, there's going to be a press conference today at 2 where I'm going to unpack that exact question. They have me talking about the side effects, so I'll pull up my notes right from now. So Pfizer's vaccine has been 95% effective, but the side effect profile has not been non-existent. In other words, there have been side effects. They've followed people after getting their shots for 2 months, median of 2 months after the second dose. They've noticed the most solicited side effects or adverse effects, they call them SAEs, have been fatigue, headache, and muscle pains. It has not been killing people, but it does cause those symptoms. And a few of them, equal to 2% or more, have been severe fatigue. So that's mostly what people are experiencing. It's been the same for older people. They're not very old, but over 55, fewer and milder side effects, interestingly. And so it's been the same across all ethnicities, genders, and so on, pretty much. So that's been good for the Pfizer vaccine. And then for the Moderna vaccine, Pfizer vaccine you take once and then you take another one 3 weeks later. You get 52% immunity from the first shot, and gets up to 95% from the second. Moderna will come next. We expect to get our first batch of those. It's going under the authorization review on the 17th of December. So they're going to get, if I would guess, they're going to get approved. And then that means just 1 to 2 days after, they're going to start shipping to us also. Their side effects, again, were pain at the injection site, fatigue, myalgias. It's always the same. Headaches and joint pain, but mostly near the injection site. And again, about 2% of individuals had more severe effects and needed to take a day or two off of work or stop their routine activities. So we're going to try to stagger things a little bit at our healthcare facilities, so we don't give everybody the vaccine on the first day and then everybody has to stay out if they're feeling a little bit down out of work the next 2 days, because we've got to keep delivering healthcare.
Thank you so much for that. Going back to the phase 1, I have a question that my mom is 87. Do I call her doctor to get placed on a waiting list?
Okay, so you definitely connect her to her doctor, because the doctor will help us directly to the Healthcare Association on how many dosages they want. We are finalizing some of these decisions right now as to where to have our hubs be. And I think ultimately it's going to be at the hospitals. That makes the most sense, although the counties may designate places to drive through, but that's the way to do it. And so she will be able to also just show up, because she'll be able to demonstrate she's 87. And we're going to publicize this very widely in the newspapers and on TV and whatnot, in the nightly news and even social media. But yes, connecting to your healthcare provider is good, so they can just pull up a list. Now with the electronic health technology we have, they'll probably be doing it on their own. And we have an algorithm that shows about 70% of people that get put on their list ends up needing the vaccine. And look, if we run out that week, then we're going to start right there on the next list for the following week when we get the next batch. So we really do intend to keep everybody in line fairly, because there's a lot of people that, we all want it, for those who believe in vaccinations, and they want to get it sooner rather than later. But we're trying to really, for all of society, reduce the risk. And that really means taking care of our kupuna. So phase 1A is healthcare workers and kupuna who live in long-term care facilities, or others if they've had tragic accidents and live in long-term care facilities and are also very vulnerable, like if they've had a severe spinal injury or a head injury or whatever, live there as a younger person. That is the top group. 1B is essential workers, and 1C is general kupuna who are healthy. And they're all mixed up together, kind of, because there's lots and lots of overlap. But essentially, phase 1 is where we're getting as many of our people into this first 80-some thousand people. And so we have to be a little discerning, but that's it. Older people, we want them vaccinated as soon as possible.
Thank you so much. Another goes back to the best way to travel safely in cars with others whom we don't live with. What's your...
Oh man, it's rough. That's how I caught COVID. My security guys, one of them was sick and we didn't know he was positive, and I caught it. We were sipping Starbucks. I was in the back seat and he was coughing. Wear your masks. Wear masks in a car. keep the windows open, and if you are lucky enough to have a larger car like an SUV or whatever, space people out. Ideally, I hate to say this, normally we want everyone carpooling, but if can, don't do that. Don't be in close proximity if people have any symptoms whatsoever, because it was, for me, a drive from Kona up to Hawaii, which was an hour and 5-minute drive that day. And I know I caught it then because I was negative 3 days before, and my friend, who's my colleague here at the LG's office, that he got positive, and then I got positive. So it can definitely happen that way because we were 2-3 feet apart.
Thank you so much for all of that information. I'd like to thank all the attendees for giving your questions. Lieutenant Governor, is there any last remarks that you would like to give everyone here?
Well, I just would like to say thanks for keeping on fighting, because lots of other interesting conversations have been had. Surveillance testing, it's worked, it's been incredible, and Big Island killed it by having all these extra people tested. That's helped us immensely. Contact tracing, if you can help with the contact tracing, because Department of Health is overwhelmed, please do. That's the way we prevented any spread from me to any of my staff. How do you eliminate community spread? Masks. You wear masks and people social distance a little bit and wash their hands. It just doesn't spread. We could have avoided all these other major programs of pre-testing and that if everyone wore masks. The arrival of COVID vaccine, you know all about that now, and it's going to be coming fast and furious. And I really think that it has to be up to people whether or not they choose to be vaccinated. There are some exceptions, I know, in healthcare settings, and so we respect one another. But for those who have a strong opposition, we trust them to behave better even with masks and social distancing. But if everyone else can join me in getting a vaccine, I'll be personally grateful, because I want to see us emerge from COVID in a truly hopeful way into 2021 so we can get our lives back. But what you've done so far has been amazing, and I just want to say again, thank you, and thank you for continuing to welcome me into the Big Island family. It really is my roots now, and I'll keep coming back forever.
Wonderful. Thank you so much. We got about 3 more minutes on our presentation. Again, I just appreciate, Lieutenant Governor, you taking your time out. As well, we want to extend a thank you to Dr. Kimo Alameda. Thank you again for sharing all the wonderful things that Bay Clinic is doing for our community as well. We really appreciate both of you. At this time, I would like to pull up just a quick survey for all of those who are watching. I'm going to go ahead and launch that onto your screens now. If you could just take the quick anonymous survey, it would really help us in the future when we do have these talks. And I'm going to hand it over to Kimo. Is there any last things that you would like to say to all of those attending for today?
Hey, awesome presentation. Lieutenant Governor Josh Green, it's always a pleasure to listen to you. Thank you for being such a great leader for our state. And also, I mean, you're very articulate, you very layman's language. I mean, when you said if can, it just reminded me of your roots. Yeah. So, and then of course, Lani, the presentation was awesome. Hawaii Care Choices is dear to me. Like I said, my mom utilizes those services, and such a great service for Hawaii. So, and then, like I said, we serve half the island. We're here to serve our beloved residents, whether or not they have the ability to pay, it doesn't matter to us. So thank you again for allowing me this opportunity to share the kind of services that we provide at Bay Clinic. Much mahalo.
Awesome. Lani, any last remarks for you?
Yeah, thank you so much, Tish. How many questions are on the survey? Just so people know to just, go down to the end. Is it 5, 7? What is it?
We have a total of 8 questions. So if you, all of those attending, could please just answer all 8 of them and click the submit button at the bottom. We really appreciate it. I'd like to just go ahead and say, Lieutenant Governor and Kimo, thank you so much again. And everyone look out for that healthcare talk later on this evening on Zoom. I believe it was 6 to 8.
Yeah, so Lieutenant Governor, thank you so much for joining us and for accepting our invitation today. And of course, Dr. Kimo Alameda, I mean, the amount of things that you are doing over at Bay Clinic, oh my gosh, it's amazing. And, you know, and I know it started with others, you know, but you're really keeping the momentum going. And yes, definitely, Lieutenant Governor, you are always going to be grounded here on the Big Island. We're always going to refer to you as this is our family. And so we were so very grateful when you accepted our invitation to come on this Zoom. And I'm sure there'll be many more. I'm just that stalker kind of type that I'm just going to keep coming your way. And I'm just talking story really right now because people are filling out their final survey comments. But I wanted to ask you, Lieutenant Governor, that I noticed in other lieutenant governors, they were never able, or I don't know if they chose not to or whatever, they never took a role like you take now. And it is so strikingly different that I wanted to know how that evolved to that point. Did you just like take the ball and run, or, you know, or did you just surprise Governor Ige? Like he was thinking you were going to be like all the other LGs, and then now you just like run to the front. So can you just share with us really briefly? We just want to know.
It really was just probably a combination of circumstances and personality. You know, I had the experience that I was lucky enough to have on Big Island for all those years, first in Ka'u, then in Kona, and even in Hawaii. And I just figured if I wanted to serve, I couldn't possibly imagine wasting 4 years of my life. Though I do still work as a doctor because it's in my blood, but I really don't know why anyone would ever take this job without trying to give it everything you got. And I looked at it as a way to learn. I'll be very candid with you. I thought about running for governor, but I waited because I respect the process. And Jamie and I, our children are pretty young still, right? Maya is 13, Sammy's 10. And a couple of years ago, I just care too much to be with them. So the way everything worked out, I decided I would ask to serve as lieutenant governor, and really Big Island sent me here because we did really well, if I may. And then after that, the way things worked out, maybe it's just the way karma is or whatever, but here we are. I have a background in healthcare as a physician, and lo and behold, COVID breaks out. We have a global pandemic. So, and I had to do a little convincing of them, like, don't waste, you're paying me, let me work on this stuff. And then I just continued to try to make sure that they could trust me, and it's gone well. So I'm very grateful to get to actually have a meaningful role, and now even to take my Hawaii experience and share it with the mainland guys. Because I'm talking to the people in the incoming, I've been friends with the healthcare people in both presidents' administrations, but now to be able to be at times an advisor to them on what Hawaii did and what we can maybe offer has been very gratifying. And so really, I spent 4 years sitting down in Bay Clinic in the Ka'u Na'alehu Clinic at my desk taking care of patients. That was not that long ago. So just strange events all conspired to let me serve.
And with that, I say thank you so much to everyone. Thank you so much, Lieutenant Governor, for sharing that with us. And you, Dr. Kimo Alameda, you still giving it out there. That is so awesome. We are really proud to have both of you representing us out in the community near and far. So thank you, everyone. Everyone take care, and aloha, everyone.